Hi guys, this is Selim Zamu, Jimmy Zamu and Kumar Pradhan. We are excited to share with you our insights on Wuchereria bankruptcy. We hope you guys will learn something through this video. Firstly, I will talk a little bit on lymphatic filariasis. Lymphatic filariasis, commonly known as elephantiasis, it is a painful and profoundly disfiguring disease. WHO has identified lymphatic filariasis as a secondary leading cause of permanent and long-term disability after leprosy. According to WHO, lymphatic filariasis currently affects the lives of 120 million people in more than 50 countries. There are three nematodes that cause lymphatic filariasis. They are Brugia malayi, Brugia timori, and Wuchereria bankruptcy. But 90% of all cases of lymphatic filariasis are caused solely by Wuchereria bankruptcy. So in this presentation, we are going to focus on Wuchereria bankruptcy. Now let's go with the classifications of Wuchereria bankruptcy. Wuchereria bankruptcy belongs to kingdom Animalia, phylum Nematoda, class Phasmida, order Filaroidea, family Filariidae, genus Wuchereria. Now let's see the distribution of Wuchereria bankruptcy. It is distributed throughout the tropical region of America, Asia, and Africa. These highlighted regions are the places where Wuchereria bankruptcy commonly occurs. Now moving on to the habit and habitat of Wuchereria bankruptcy. It is a dreaded endoparasite of human beings. It is not a zoonotic parasite and thus it is not found in any other mammals. They complete their life cycle in two hosts, man and mosquito. In humans, it can be located in lymphatic vessels and lymph nodes of the body, particularly in the groin region. Now let's talk about the morphology of Wuchereria bankruptcy. Adult worms are transparent, creamy white, long, hair-like structure. It is filiform in shape with the both ends tapering. And as you can see in this picture, male is shorter as compared to female. The height of male is 2.5 to 4 cm long and 0.1 mm in breadth. And the height of female is 8 to 10 cm long and 0.2 to 0.3 mm in breadth. This is the head end of both and this is the tail end. Now look at the tail of male that is curved and the tail end of female that is straight and narrow compared to male. The tail end of the male have these two spicules and the lifespan of adult worm is 5 to 10 years. Now let's talk about Microfilaria, that is the larval form of Wuchereria bankruptcy. They are transparent with blunt head and pointed tail. They measure up to 245 to 295 micrometer and 7.5 to 10 micrometer in breadth. Microfilaria is covered by hyaline sheath which is longer than microfilaria. Let's say it's up to 350 micrometer. As you can see in this picture, it's definitely longer than the microfilaria. Hyaline sheath helps microfilaria for movement. The somatic cells or nuclei appear as granules in the central axis of the microfilaria. Tail tip of the microfilaria is free of nucleus and it is called as tail end. And the anterior is having cephalic space and is called cephalic end. And there is anterior V-spot, rennet cells, which contains excretory pores. And then there is posterior V-spot, anus, which contains anal cells where nuclei are absent in these parts. And in the cephalic end, there is nerve ring and and in the tail end there's four genital cells.
Now to talk about the life cycle of Wuchereria bronchiectasis. When an infected mosquito feeds on a human, it injects the infected larva into human's bloodstream. The infected larvae migrate to the lymphatic vessels where they develop into adult worms over several months to years. The adult worms reside in the lymphatic system where females produce microvilli, which are the first stage larvae. When mosquito feeds on human host, it ingests the microvilli along with human blood. Inside the mosquito, the microvilli develop into a first stage larva and the infective stage called the third stage larva within 10 to 14 days. Once the larvae reach the infective stage, they migrate to the mosquito's head, ready to be transmitted to a new host during a subsequent blood meal, thus completing its life cycle. Epidemiology. Under this topic, I am going to cover how the transmission occurs, who is most at risk, and the factors influencing its spread. Firstly, transmission by mosquitoes. When a mosquito bites an infected individual, it ingests the microfilaria of Wuchereria bronchiectasis along with the blood meal. Inside the mosquito's body, the microfilaria develop into infective larvae which readily get transmitted to a new host during subsequent blood feeding. Secondly, most at risk. People living in endemic regions of tropical and subtropical countries are most risks of contracting lymphatic filariasis. Individuals who spend a significant amount of time outdoors, particularly during peak mosquito biting times, are at higher risk of exposure to infected mosquitoes. Children, due to their lower immunity and increased outdoor activity, are often more vulnerable to infection. Thirdly, factors influencing spread. A. Vector ecology. The distribution, abundance, and behavior of mosquito vectors play a significant role in the spread of Wuchereria bronchiectasis. Factors such as mosquito breeding sites, climate, and habitat suitability influence vector populations and their capacity to transmit the parasite. B. Environmental conditions. Warm and humid climates are conducive to mosquito breeding and survival, facilitating the transmission of lymphatic filariasis. Changes in temperature, rainfall patterns, and land use can impact mosquito populations and disease transmission dynamics. C. Human behavior. Activities that increase exposure to mosquito bites such as outdoor work, lack of protective measures, example bed nets and insect repellents, and living in close proximity to mosquito breeding sites contribute to the risk of infection. D. Socioeconomic factors. Poverty, inadequate sanitation, and limited access to healthcare and preventive measures increases the spread of lymphatic filariasis. E. Migration and travel. Movement of infected individuals and vectors between endemic and non-endemic areas can introduce the parasite to new regions and contribute to the global spread of lymphatic filariasis. Migration patterns, travel, and trade influence the geographical distribution of the disease. Pathogenicity. To talk about the adult worms, adult Wuchereria reside in the human lymphatic system, causing inflammation and obstruction of lymph vessels. This can lead to number 1. Chronic infection. Wuchereria bronchiectasis infection leads to chronic lymphatic filariasis characterized by the presence of adult worms in the lymphatic vessels and lymph nodes. The parasites cause lymphatic obstruction, chronic inflammation, and tissue damage over time. Number 2. Lymphedema. Chronic lymphatic obstruction and inflammation can cause lymphedema, which is a condition in which fluid accumulates in the tissues causing swelling, and a condition known as elephantiasis, which is a severe form of untreated lymphatic filariasis. Number 3. Hydrocele. It is a condition in male individuals whereby the chronic infection with Wuchereria bronchiectasis can lead to the accumulation of fluid in the scrotum. Hydrocele results from the obstruction of lymphatic vessels draining the scrotal area, leading to fluid retention and swelling. Now to talk about the microfilaria. Microfilaria themselves don't cause significant damage, however, a high number of them in the bloodstream can trigger inflammatory responses that contribute to tissue damage.
Now let's talk about the treatment. We can treat parasite disease by using the antiviral drugs A. DEC. These drugs used to treat the lymphatic paralysis, which will kill the larvae in the adult worms. By taking the 6 mg for 12 days can completely treat the paralysis disease. Another drug is ivermectin. This is also used to treat the parasite disease but has less effective than the DEC drugs. Another drug is albendazole. It is often given to patients with combination with DEC and it will reduce the number of larvae parasite in the bloodstream. Now let's talk about the prevention and the control method. The main principle to control parasite is by avoiding mosquito bites. Number 1. Sleeping under a mosquito net. At night, sleeping under a mosquito net can prevent the mosquito from biting. Number 2. Wearing long sleeves and trousers. It can also prevent from the mosquito bites. Number 3. Using the mosquito repellent cream. It will repel the mosquito and we can use during the dawn and dusk time. Fourth one is getting rid of mosquito breeding areas. We can get rid of mosquito breeding areas by keeping the clean surrounding areas, cleaning drain and toilets, filling up the ponds and pool. We can prevent parasitic disease by giving the mass advice to uneducated peoples. Now let's talk about the economic importance to human. There is no positive benefit but only the negative one. This parasite causes disease called paralysis, which target the genital areas and lower area. The disease is rarely fatal but causes great pain to victims, reduce overall living quality of human. Acute infection includes lymphadenitis and lymphadenitis with fever. Chronic infection includes elephantiasis, in which patients experience massive swelling of body parts. There is no cure for this condition and patients have to go often surgery to remove calcified tissue. Economic importance for agriculture. Wuchereria parasites don't have direct economic importance in agriculture, but its impact on human health can indirectly affect the agricultural productivity. Poor health of farmer result in the less productivity of product.